Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and someone who's been living with my own chronic pain for over 30 years. Today I want to talk about the topic of freedom versus suffering. And for me, that has been a really important part of my pain management journey. I've talked about it many times, I've blogged about it many times, but I think it bears repeating. Because too many people living with debilitating chronic pain often cannot tell the difference between pain and suffering. That's one of the first things I work with people on when I work with them. I usually tell people at the first session that in order to have freedom from suffering, you've got to make peace with your pain. You've got to look at pain as an ally, not an adversary. And many of them get really mad at me for this, and they look at me with total disbelief. Nevertheless, it's a true statement. And pain is often inevitable. There are some pain conditions that I don't think, for some people, will ever completely go away. I know for me that there are days when I'm relatively pain-free, and there's other days when my pain flares up and it gets very intense again. I can remember a time in my early recovery process where I was really depressed, unhappy, grieving my past level of functioning. I couldn't do construction work anymore. I couldn't teach martial arts. And I was feeling hopeless and helpless, and I sank into what I call the chronic pain trance. And a chronic pain trance is a set of automatic and self-defeating thoughts, urges, and behaviors, and the accompanying uncomfortable emotions that lead people to that sense of becoming hopeless and helpless. True freedom from suffering is about learning how to differentiate between the physiological symptoms of pain and the psychological emotional symptoms of pain. And I try to keep things simple with the patients. They don't need me to be giving them long clinical terms. I know how, for me in my early process, before I had a lot of education and training in this field, if people would have told me psychobabble terms or clinical terms, it wouldn't have made any sense. So I try to keep it simple. Basically, when people have pain, a signal gets sent to the thalamus, and the thalamus sends a signal to the frontal lobes. We have a thinking or cognitive response. It gets sent back to the primitive brain, the amygdala limbic system, and people have an emotional response. And I often call this the amplifier, because although it's automatic, when people live with pain 24/7, 3 to 6 months or longer, eventually they start amplifying the symptoms. When they have a flare-up, for example, and saying, "Ooh, that hurts," they'll say, "Oh man, this is horrible, terrible, I can't stand this, it's killing me." And this is the kind of language that has got to stop in someone's head. I've got to challenge my self-defeating thinking when I move into that suffering. And I know before I started writing the book, Freedom from Suffering, A Journey of Hope, I was in some of the worst pain I'd been in for over 20 years. And I caught myself going down into that trance again, and I wanted to stop it. And so I had to start practicing what I teach. And it's been an important journey for me, and one that I really am excited to share. To learn more about this freedom from suffering, if you're watching this video on YouTube, go down below and look at the link in the text, and go to my personal blog page and learn more about this. Remember, freedom from suffering is your right, but it's also your responsibility. So be responsible. Learn as much as you can about your pain and your pain management so you can develop an effective chronic pain management plan and avoid the chronic pain trance. Thanks.